Hello everyone to the lower respiratory tract system. So we will be discussing two chief complaints, cough and shortness of breath, okay? So same as usual, let's talk about cough. Cough, we ask about when did it start and how long you've been having it, constant, intermittent, medical history, family history, social history. After that, we go to the differential diagnosis. We ask about something very important, which is it we ask, is it non-productive cough? Is it productive bloody cough? Because it has different differentials. Is it productive cough? Productive has a different differentials, okay? So first off, before we go to the differentials, there are questions that you ask. Is the cough associated with a phlegm? This is important. So it's productive. If there's a phlegm, then we ask A, B, C, O. A for amount, B, blood. Is there blood or not? C for color of the phlegm. What color is it? O for the odor of the phlegm. Okay. So now for non-productive cough, if they after these questions, if they say non-productive cough, the non-productive, then we have differentials. Could be GERD, could be medications like AC inhibitor, like lisinopril can cause that. Fibrosis, acute bronchitis, and asthma. Those are the differentials for non-productive cough. So for GERD, what do we ask about? We ask about any burning sensation in your chest or any change in the taste of your mouth. I would say just ask about the heartburn. That's I think should be enough. For medications, are you taking any medications? We're already gonna ask about that. Fibrosis, what do you do for a living? This is important because the occupation is important, okay? If they're coal miners, could cause fibrosis, or asbestos can cause that too. Have you ever been exposed to radiation or cancer drugs? Okay, these can cause fibrosis. Acute bronchitis. Have you recently suffered from a flu? Runny nose, watery eye, sore throat, fever, fatigue. Okay, after that they develop acute bronchitis. I had a typical case yesterday. A patient just came in, had the flu, and developed chronic bronchitis. For asthma, nighttime awakening, okay? For asthma, okay? Nighttime awakening for asthma is in the morning, okay? So you ask him, do you wake up in the middle of the night coughing, okay? Is it related to exercise? Like, does it get worse when you exercise, okay? Do you have any pets at home, okay? This is important. Do you have to wake up at night to catch your breath? If yes, then the timing. What time is at night, okay? So this is for asthma. All of these are non-productive cough. What if the cough is productive? Productive, then we think of CHF. This is funny character, like congestive heart failure. For aspiration, pneumonia could be, or it could be just pneumonia. Okay, so or it could be just atypical pneumonia. Okay, so let's do that. Okay. So for atypical pneumonia, we ask about, is it continuous or intermittent, and we ask about chills. Okay, do you feel chills? Okay, night sweats associated with that. For regular pneumonia, we ask about, have you been exposed to anybody with similar complaints? Okay, like sick contacts. For aspiration pneumonia, have you experienced any loss of consciousness recently? So when the aspiration is like lose consciousness and they aspirate their oral fluid, oral fluid, like loaded with bacteria. So this goes to the lung and causes infection. The second one is that, have you noticed any difficulty swallowing? Okay, this is for stroke. For congestive heart failure, do you have to use more pillows than usual? Okay, this is important question to ask, because orthopnea, paroxysmal nocturnal dyspnea, and exertional dyspnea. Do you have to wake up at night to catch up your breath? Okay. Paroxysmal nocturnal dyspnea. That's what we're asking about. Do you wake up middle of the night just to catch your breath? This is a sign of heart failure. Symptoms of heart failure, sorry. Have you noticed any swelling of your feet? Edema. This is important. Do you have to use more pillows than usual? Okay, this is important too. One time I had a patient, he said, oh, I have coughing just because my neighbor starts smoking. And then in physical exam, I see huge edema. Boom. He was thinking just because of the smoking that his neighbors, and it happened to be that he has CHF, pneumonia, and all of these together. So this edema is very important and indicative of CHF. And the last one, COPD, can cause productive cough. Do you have shortness of breath? And you notice abnormal sound while breathing? You can ask about it or not. It's not that important. Wheezing. You mostly on physical exam you see wheezing. You hear wheezing. So for the bloody cough, productive and bloody cough. Wow, this is serious. More serious. So it could be three things. It could be TB, important. Could be lung cancer, and could be bronchiectasis. So for TB, what do we ask? We ask, when was your last PPD test? Yes, the result. Have you been exposed to anybody with similar complaint? Okay. Because PPD, we ask if they have latent TB. Sick contacts, this is important. Have you experienced any night sweats? Okay. And have you traveled recently to endemic areas? Okay. These are the four things we ask about. For lung cancer, we ask any smoking, weight loss, appetite. Three things indicative of lung cancer. For bronchiectasis, we ask, do you have to assume a specific position to produce phlegm? Because this is important. They produce like in a specific position to produce phlegm. This is a symptom of bronchiectasis, so pay attention to that. Very important question. Okay, so in a summary cough, we have three things. If it's non-productive, could be GERD, medication, fibrosis, acute bronchitis, asthma. If it's bloody, then it's TB, lung cancer, bronchiectasis. If it's non-bloody productive, COPD, CHF, aspiration pneumonia, whether it's aspiration or just general community acquired or atypical pneumonia. And this is the cough. After that, we just do physical exam, hint, heart, lung, and we do sputum stain on culture, CBC, CMP, blood culture, chest x-ray, CT scan, and we can do a bronchoalveolar lavage if we think it's aspiration pneumonia or we think that it's aspergillus pneumonia or something like that. Now for shortness of breath, this is going to be a little bit easier than cough. Okay. For shortness of breath, we have several differentials. Could be chronic obstructive pulmonary disease, could be congestive heart failure, could be aspiration pneumonia. It could be pneumonia, just a pneumonia. It could be pulmonary embolism, this is important. Could be fibrosis. Could be anemia, could be TB. So we talked about how to ask questions about a lot of them, but we're just going to go over them like really quick. Just to a rapid recap review. For COPD, you have any shortness of breath, and you notice abnormal sound while breathing. They may hear wheezing. For congestive heart failure, do you use more pillows than usual? Do you wake up in the middle of the night to catch a breath? Have you noticed any swelling in your feet? Okay, they use more pillows because when they use more pillows, the fluid will go down, so they breathe better. And they wake up, so with the standing position, they breathe better than laying back. So that's why they wake up middle of the night. And they have swelling. For aspiration pneumonia, any loss of consciousness, and any stroke recently. Okay, so she has a stroke too, not just alcohol. Asthma, you ask any relationship to exercise, that's number one. Pets at home, do you wake up at night to catch a breath? Okay, catch a breath. For pneumonia, you've been any sick contacts and phlegm. If there is any phlegm, well then we do ABCO, okay, which is amount blood, okay, and odor, and productive, if it's productive or not. Pulmonary embolism, we ask, have you noticed any, 3 questions, very important questions. Have you noticed any cough pain or swelling, sorry? Have you been immobilized recently? History of immobilization, this is important. Are you using any oral contraceptive pills recently? Okay, 3 things. For fibrosis, you ask, what do you do for living? Okay, this is important. And then, have you been exposed to radiation or chemotherapeutic drug? For anemia, 3 questions. Have you noticed any change in the color of your skin? You will be pale. Have you noticed any shortness of breath on exertion? Okay. Have you noticed any bleeding from any side of your body? Okay, 3 things. For TB, our usual 4 questions. Last PPD, any sick contacts, night sweats, travel. Okay, 3 or 4 things, remember. Okay. Now, so there is a mnemonic for it, I remember. P-E-N-T. It's called PINT. P, PPDE, exposed, and night, T, travel. That's why they're capitalized. Okay, now for shortness of breath, quick recap. COPD, CHF, aspiration, asthma, pneumonia, pulmonary embolism, fibrosis, anemia, and TB. What do we do after that? We do physical exam. Heart, lung, hint, okay? And then we do sputum based on the differentials. Like for TB, we do TB test, like sputum stain, anemia, we check CBC, CMP will tell us that. Pulmonary embolism, we do D-dimer. If there's high risk, we do CT angio, pneumonia, chest x-ray. Asthma, pulmonary function test, especially pneumonia, chest x-ray. Chest x-ray will tell us that too. COPD, pulmonary function test. Okay. So here's the summary of the lower respiratory tract chief complaints. Thank you so much for listening, and I hope you enjoyed this video.